My name is Mikayla Engstrom, and over the summer of 2021, I completed the Rural and Underserved Opportunities Program, also known as RUOP, for the completion of my Independent Investigative Inquiry, or III. For my RUOP experience, I was placed in rural Montana in a small town called Cut Bank. During this time, I completed an intervention analysis of diabetes education and prevention. I hypothesized that improvement of health literacy about type 2 diabetes, healthy behavior promotion, and prevention of disease progression could be attained with the use of a lifestyle change program, the details of which I will discuss later in this presentation. The city of Cut Bank sits on the eastern edge of the Rocky Mountains in Glacier County, Montana. Due to the town's proximity to the Blackfeet Indian Reservation, there is a high American Indian population in Glacier County, representing about 65% of the overall population. Due to the low socioeconomic status of Glacier County compared to statewide averages in poverty rate and median household income, community members may face many obstacles when it comes to acquiring adequate management of their diabetes, access to quality foods, and educational programs. Epidemiological data show there are higher incidence rates of diabetes and obesity and higher mortality rates due to diabetes in Glacier County compared to the state of Montana. Therefore, there seems to be inadequate education for patients about diabetes prevention in the Cut Bank community and surrounding areas. I was able to interview members of prominent community organizations that address health promotion and education in the community. One of those organizations was the Logan Health Cut Bank Clinic. I spoke to the Community Health Improvement Manager, who was able to tell me about the many programs currently employed by the clinic that address chronic diseases and promote healthy behaviors. These programs encourage people in the community to embark on a healthy journey and utilize lifestyle management as a means of preventing chronic disease and staying healthy. Programs such as the Montana Living Life Well and Prevent T2 programs provide additional support for patients with chronic diseases by providing tools for patients to self-manage their conditions, supplementing standard primary care practices. I was also able to learn about the special supplemental nutrition program for women, infants, and children through the Glacier County Health Department. This program has been well developed in Glacier County and provides a variety of nutrition support from educational handouts and dietitian counseling to food benefits. It aims to address the health and nutrition risks that many low-income community members face. I then conducted a lit review of peer-reviewed studies regarding lifestyle intervention programs that are used in the prevention of type 2 diabetes. The two programs that seem to be the easiest to implement in the Cut Bank community are discussed here. The first intervention of interest is the Prevent T2 program, which is a CDC-recognized lifestyle change plan that is based on the original diabetes prevention program, also known as DPP. The curriculum for the program aims for modest weight loss and increased physical activity, but also incorporates more inclusive educational material to reach those with lower reading levels and varied language proficiencies. This program is specifically targeted towards pre-diabetes education to prevent progression to type 2 diabetes. It includes a series of lifestyle intervention sessions and follow-up for 1 year. The results of the DPP outcome study show a 27% reduction in progression to type 2 diabetes in pre-diabetic patients within the program. The second intervention analyzed in this review was the Let's Prevent Diabetes program. This study notes that there is a lot that can be done to prevent the progression of diabetes, but it is often difficult to implement in a standard primary care setting. Therefore, this lifestyle and behavior change plan was employed by utilizing existing infrastructure within routine care. The focus of this program is to promote attainable goals for behavior change surrounding diet and exercise and increase patients' knowledge about impaired glucose regulation, prediabetes, and progression to type 2 diabetes. It aims to educate patients about realistic perceptions of diabetes and is primarily focused on patient empowerment. The study resulted in a non-significant 26% reduced risk of progression to type 2 diabetes for pre-diabetic patients. In conclusion, the benefits of diabetes prevention and delay of progression are substantial, including the potential reduction in long-term complications that may lead to increased morbidity and mortality for diabetic patients. Lifestyle intervention and educational programs like those discussed previously are of significant value to any community. Due to the current limitations for diabetic counseling with nutritionists within Glacier County and surrounding areas, A lifestyle intervention program such as those discussed within this analysis would be beneficial to the community. Thank you for listening.